Yeah, thanks, Koos, and lovely joining this session, and thanks so much for inviting me to share a couple of reflections, I guess, on the questions of what it is to work at the moment in the UN to fight against COVID, and to what extent it had changed in our focus, personal focus, professional focus, institutional focus, and especially also in Kenya, where I work. I think after we spoke, I reflected a little bit, and I think like every time what comes to mind is that this is in a really strange way, but beautiful way, also one of the most rewarding times to work for the UN. Like this is why you work in development. This is one of the most important fights which we have come across for long, and this is where we should all stand together, and where it's very easy to let your passion boil over almost. But it has required a significant shift in focus. Never has the lens of the Sustainable Development Goals, the SDGs, been lost. It has remained for sustainable development, for people, for planet, serving those who are left furthest behind, making sure that the vulnerable receive care, that communities receive care. But where I personally, over the last years, have been leading a team of experts which have been building really long-term, long-lasting health system strengthening programs with significant financing against them. So really longer-term interventions for system strengthening. It's now just all hands on board. It's very rapid action. I'm now seated in the National COVID Task Force in Kenya, which is coordinating our entire response in Kenya. I'm managing internally a lot of the coordination regarding our internal setup, so how to change your teams and how to change your institutional capacities to deliver much quicker, much faster support which is needed, and support which is needed in a drastically dynamic environment, because as COVID is coming at us, it's continuously evolving, right? The evidence is evolving, the interventions, the policies, and everything which you thought yesterday was really important and worked now, tomorrow it may not, or you need to tweak it. So it is a lot of change in focus and in the type of work and how you do it, but it's always through the lens of the Sustainable Development Goals. On top of that, of course, also just from a personal perspective, it's a very strange, like working in Kenya. I have sometimes team members who would go to the bordering counties, to the bordering, I guess, states, to Somalia, where there's still the threat of terrorism and Al-Shabaab, and that brings personal concerns, and there's a lot of risk management involved there, but you know how to go about it. At the moment, if you send teams to the front line as we speak to it, there's an increased risk of a virus you don't yet know how it works. So there's a lot of emotional pressure also on everybody, I guess, as everybody on the line, probably around family members, and then you have also around colleagues. So how to deal with that and how to manage that is a ball game by itself. As a result, though, and very proudly so, the UN, and with the shift in that focus, we already tried to, in lockstep with the government, of course, did a flash appeal for what is needed to fight COVID, and especially provide support to the 10 million Kenyans most at risk of suffering hardship, both due to the disease or the socio-economic impacts of the pandemic. And we've been able to really quickly repurpose $45 million of our programming and raised another $60 million. So there's, in only 6 months' time, there's significant investments taking place in making sure that the health system is ramped up, that very basically health workers are trained, have protective gear, know which protocols to implement, have everything which is needed, ICU capacities and other I guess essential services which are required in the fight, that they are really quickly ramped up, because in Kenya, vis-a-vis, for example, the US, the health systems are fairly underdeveloped. As much as very important strides have been made, there's still a significant lack and lacking capacities within the health system. So the moment the pandemic really breaks out, health systems are under significant stretch, and you wouldn't be able to cope anymore. And definitely not if you want to continue also with your essential services, because not everything is about COVID. And that brings me also to UNFPA. And that's something we're discussing here a lot about a whole of society approach, public health at the heart, but how do you make sure that COVID doesn't take over everything? UNFPA, the Reproductive Health Agency, we're talking about a silent pandemic at the moment of adolescent girls, the teenage pregnancies, which are skyrocketing because schools are closed, because of the policies which the government needed to instill to flatten the curve. But in the meantime, the side effects are that other things are happening: gender-based violence because stress in the household and everybody's contained. Lack of women searching for basic antenatal care, reproductive health commodities, contraceptives which are not being picked up again. So there's a lot of side effects of a single focus on COVID and the policies and the preventive measures the government needs to instill, which unfortunately are just also having impact on many other issues, including reproductive health, which of course, as UNFPA, we would fight very hard that young girls, women continue to have access to reproductive health care, continue to be able to fall pregnant as they want and to deliver safely, and that they never would need to suffer the hardship, men or women, of gender-based violence and so on. So the mandate, the mission we fight for and strive. So those are some of the things which are going. Then the perspective a little bit of what you asked about Kenya. Let me focus on Kenya because it's a very strange. If you listen sometimes to the numbers, it's a very strange story, because at the moment I believe we have around 16.5 million cases, 650,000 deaths around the world. This is, and then close to 9-10 million recoveries. So Africa's contribution as a continent is still very limited, but the pandemic is growing. So it's every time if you follow the news where it started in Europe and then or it started like China, then the hotspot becomes, and people are talking about hotspot. And so far our continent hasn't picked up as much, fortunately. There's models around it which and evidence which may suggest or may not. We're still trying to figure out why that is. Is that because of our demographics, a much younger population? Is it because of climate, or is it about viral resistance, because the fight on this continent for so long against HIV, TB, and so on? So, but the time will need to tell. And then like as much as you can, such things can give you a lot of hope. The truth just is that you just see the numbers doubling and doubling and doubling, so that we have the feeling that for us the curve is just starting. So as much as we had hoped that we maybe pass by it, right? Like that's something everybody hopes for. So in Kenya at the moment we're almost doubling rates. The government has done fantastic from early March when the first case was caught. In almost immediate lockdown and all kinds of preventative measures, from stay at home as much as possible, wear a face mask, keep a safe distance, wash your hands. So really to contain the spread, but unfortunately also here community transmission and other things is going on. Like we are now reaching close to 1,000 cases every day, and you just see the health system being stretched. So the percentages of the impact of mobility and death is much higher. Here. Nevertheless, it's a country, Kenya. This is of around 50 million. So the fear just is that we have just started, that we're getting to a pace of transmission which is very hard to manage. So every time that is the dynamic, then as the UN, as a development agency, you're trying to figure out with government what works, and what can you do to make sure that the pandemic doesn't hit too hard. Again, government of Kenya is doing an incredible job. I think all partners, it's an amazing, as I said, rewarding time to work, but you just also see how hard it is. How hard it is because you don't precisely know what you're fighting against, but also how hard it is to find a balance in, as I said, do you go blindly to build up a health system to fight COVID? How do you do that? How do you protect livelihoods in the meantime? The moment you close schools, the loss of income through the loss of jobs, like after a couple of weeks already, due to the socioeconomic impact of COVID, the reports already said that it's more and more families were at least going without one day without food, and those numbers are crawling up. So do you continue to invest in public health, or do you continue to make sure that people are fed? So how do you find that balance? Incredibly difficult, not only for the Kenyan government, the US government, Chinese government, European governments. Everybody is struggling with how to go about it. And then there's so many philosophies, right, and streams of thought where you can choose from, which doesn't make it easier. And on top of that, always the political and other interests at play, which makes our world tick, but not the easiest way to manage, because a lot of frustration comes with it at different sides of the corner. The positive note, just to from a personal perspective, but also here, especially in Kenya, just to close with, and would love to engage and learn more from your views on what is happening in the world and how best to go about it, and potentially what the role of the UN could be. Is that where I really see, and I think Courtney, we've been working on this and talking about this for over 15 years now, is how partnerships and innovation can play such an incredible role. Like I've seen incredible resilience from the business community, but also the public-private divide of how to work together. In Kenya, local manufacturers have turned around and are now suddenly producing PPE and sanitizers and making use of that market opportunity, but really to drive social impact. So business growth through social impact, finding purpose and following purpose, and making that your business model. And I've seen amazing stuff happening there, from within the fintech space around social protection schemes and conditional cash transfers to basic distribution and manufacturing of commodities which are needed. And unfortunately, sometimes the world closed down on us, right? Because the demand was so hard in other hemisphere that we were falling short of sanitizers, we were falling short of PPE. So how then to protect yourself, how to protect your health staff? That's the only way that when you start producing yourself, and then you do it in a way which is affordable and of good quality. And I've seen such things happening in Kenya. We've been part of such models and such transitions, and that's tremendously exciting and gives a lot of hope that how much can happen also here in this part of the world, which sometimes believe it can't. Some people still have a particular view of this continent where we talk about it, especially in Kenya, as the hotbed of innovation and entrepreneurism. And I think this country and region is truly proving itself during COVID. Then the final piece is just a call, just knowing the world we live in. I think now more than ever, it's really important to promote solidarity and globalization and to stand together. Multilateralism is more important than ever. So sometimes you see a move, and it's fully understood of countries becoming more inward again. The discussion about WHO is broadly in the news, but such things shouldn't take place now. We should really stand together. We should really step up for the world. It's a global outbreak. It's a global pandemic. You wouldn't be able to fight it by closing down the borders, by keeping all the goods you have for yourself. So really, our call to action is really work together, find ways to work together, find ways to manage this from a global perspective, and to do that with solidarity. So the ones who have more, make sure you share, because on the long run, that will yield. On the long run, the Sustainable Development Goals, as much as it's a romantic, beautiful framework for sustainable development, it's one of the most interesting business propositions for long-lasting growth, long-lasting economic output. So if we won't be able to protect our planet, if we won't be able to protect our communities, like what kind of markets will we leave behind, right? Like not talking even about the emotional aspects of what kind of world do we leave behind for our children. It's just what kind of market. So that's a thinking which we hope will come through much more in the dialogue and the discourse around the world, and that's as much as it's a dialogue. So you always have opposing and views against the ones who stand with you, but that somehow in between there will be able to find a pathway towards the Sustainable Development Goal, but through defeating COVID also. Yeah, a lot of words from me. I hope it was was a bit interesting. So as said, like, happy to take on any questions. Would love to learn also from your views again. Happy Courts also, if there's questions after this setting, that you share my email, and then yeah, let's take it from there.
Right. We are, let's see. We have 6 minutes left. Does anybody have any questions they want to shoot through the chat? Or you can unmute yourselves and ask yourself as well.
Ruben, like. This is Patty. Thank you very much. That was really interesting and helpful. And I was particularly taken back by what you said. Not everything's about COVID, and what are other people doing. Here at one of our children's hospitals, they're realizing that because of COVID, people aren't bringing their babies in for shots for their basic measles, mumps, rubella, polio, and these are still out there. So one of the doctors has gone mobile, and he's bringing the shots to them, which is really amazing. But it's just things we don't think about. So I think that's really important to keep. The world exists, and there's other things out there we have to fight, coinciding, and making sure that people are not looking only at the one. So thank you for bringing that up again.
Yeah.
And spot on, and that's something we should continue to speak to. The danger of always of getting totally caught up in one agenda is just to lose track of other agendas. We consistently through the World Health Organization and other parties which are part of the national task force I'm sitting in are getting reviews of statistics against what is the impact of COVID, but also under 5 mortality rates, like vaccination rates, like is it dropping, and how then can you become inventive in making sure that such things don't happen, and that you don't distort all the capacities and all the resources away. Because as you say, it is a danger. It is a danger that vaccinations stop. It is a danger for women who like pregnancies will still happen if you don't have your antenatal care, if you can't deliver on the skilled attendants. There's so many risks if we just get into that silo view. So we need to keep our eyes open and make sure that all the essential services are covered. Yeah.
Hey, Ruben, I had a question in terms of you guys on a daily or weekly basis, how do you determine what challenges or issues you're going to tackle as an organization in collaboration with NGOs or other people and things like you meet on that daily, weekly, monthly to make that prioritization?
It's super hard. Like I've never, honestly, as I said, like at a certain point, I thought it was always complex to build really long-lasting, large-scale partnerships, but the complexity of this one is incredible. Throughout the continuum of care, we have almost daily meetings to discuss certain challenges and to pick it up around details, like which lab is working or not. Is it the lab which is working? Are the specimens are not there? Where are the doctors in the 47 counties? So there's a lot of details which are set up. On a weekly basis, we build a structure, I guess, for it. So the coordination structure is that there's a national entity, and then there's different task groups, and those task groups are having then national and local footprints, and they have their own special, I guess, mandate, and with experts looking around it. And then at the national task force where I sit is that you like decisions are trickling up. So the challenges and the priorities, which at a certain point can't be addressed anymore and are so cross-cutting, are then at a weekly basis being discussed and decided upon on how to act on them in the national task force. A lot of other challenges, multitude, probably 90% of the challenges will be discussed at the technical levels, where the technical experts are, which would truly understand what the issue is or what the issue could be. Because health is a complex one, right? Like it's a very scientifically grounded field. So if you, I'm for example personally not a medical doctor. I've grown now over the last 15 years in public health, but I'm not a medical doctor. So a lot of clinical facts I wouldn't be able to follow. So you see really how from a strategy level and the higher levels the trickle ups are, and then the priorities are done on a weekly basis. And then trickling down a lot of the technical work, and then on a monthly basis is we have on daily basis the Ministry of Health, which we serve, I guess, is giving an update, and then on a monthly basis, or at the moment almost on a bi-weekly basis, the president is giving a speech in which he announces certain new policies or other interventions which may be needed, and which are then always, I guess, also as in the US or elsewhere, are like, are we on lockdown? What do we need to wear face mask? At the moment, one of the bigger ones is no serving of alcohol anymore, not beyond curfews, but not in restaurants anymore. because the share reason, the moment a lot of people drink alcohol, more accidents happen, it stretches the healthcare system, and we don't have that bandwidth anymore in the healthcare system. So you really start cracking down on the injuries and the accidents which overload you at certain times, so that you make space for people who unfortunately would attract COVID. Yeah, I hope that answers the question a little bit.
It did. Thank you.
Yeah.
Thank you, Ruben. I am always very cognizant of keeping our time. So we have 1 minute left. So I'm going to sign us off. But Ruben, this has been, first of all, thank you for doing this. Thank you for the insight that you provided. I think it's so amazing to hear about what an organization like the UN, a multilateral organization, a global organization, is doing in this time. And I also thought it was really helpful to hear your perspective on what are the other side effects from COVID, like for adolescent girls, for pregnant women, for people getting vaccines. So, and how you as an agency and in your job are working so closely with others and in partnership with others, and also your comments about, you know what, if we don't do the SDGs, we don't have markets. So just everything you said was so insightful and really helpful, and really appreciate it. And we will share this recording with everybody. There's been a lot of chat going on. We will share the chat as well. And just thank you, all of you, for continuing to show up and for all of the hard work that you're doing. And take care, stay safe, and thank you all. And thank you again, Ruben. That was awesome.
Okay, thanks, Coach. Thanks, everybody. Sue, wonderful to connect also. I hope you enjoyed also. And then, yes, stay safe, people. Stay healthy, stay happy.